Now, Erb's palsy is also called as Erb-Duchene's paralysis. The site of injury is C5-C6 nerve roots. It is the most common type, seen in 90% cases according to Klumpke. In this, muscles of shoulder and upper arm are chiefly affected. There is loss of abduction at the shoulder, there is loss of external rotation, and there is loss of supination. So the typical deformity produced is called as policeman or porter tip hand. What is this? There will be adduction of the arm, it will be internally rotated, and it will be pronated with a flexed wrist. So this type of hand will be seen in policeman or porter tip hand. You have read about it in your MBBS as well. On examination, there will be absent Morrow's reflex on the affected side, and there will be absent biceps reflex also on the affected side. However, the power in the forearm muscles and the hand grasp, that is retained. In fact, Klumpke, Nelson and Avery all three agree that if there is a child who has Erb's palsy and hand grasp is good, it is considered to be a good prognostic factor. Very rarely you may find that along with C5 and C6 injury, some degree of injury may happen to C4 nerve root also. We know that C4 nerve root is responsible, it supplies to the phrenic nerve, and that is why diaphragmatic involvement or paradoxical breathing can also develop in these children. But in vast majority, it is Erb's palsy alone, the policeman porter tip hand, which is seen. The second type of injury is Klumpke's paralysis, which causes C8, which arises due to C8-T1 injury. So it is less common, it is seen in less than 1% cases. Intrinsic muscles of the hand and long flexors of the wrist and fingers are primarily affected. The grasp in these children, the hand grasp in these children is absent. The affected limb tends to become small, and there is also sensory impairment on the ulnar side of forearm as well as the hand. The biceps and radial reflexes are normally present. The important association on which a question can be asked to you even in your vivas, it is often associated with Horner syndrome on the affected side, ptosis, miosis, anhidrosis, ophthalmoplegia on the affected side due to damage to sympathetic fibers if sympathetic fibers get affected at the T1 nerve root. And the third type of injury is total brachial plexus injury. It comprises about 10% patients, and the entire nerve roots from C5 to T1, they are affected. The entire arm is totally flaccid. All reflexes including grasp and sensation are absent, and this variety can also be associated with Horner syndrome if the sympathetic fibers are affected. So these are the three types of injuries, along with the details, the points that you should remember for theory, for practicals, for your vivas and for your clinical practice.